Hi, I'm Donna Dowell, board certified family nurse practitioner and part of a growing number of healthcare professionals in New Mexico in support of the New Mexico Health Security Plan, a plan that will ensure comprehensive, quality healthcare coverage for New Mexicans. Healthcare under our current system is challenging for many. This short video is part of a series that features the personal healthcare stories of real New Mexicans, stories you will recognize as all too common.
My name is Joseph Duran. I am a science teacher at Washington Middle School. The reason I'm doing this is because I was asked to share my stories about, not being insured, and there was plenty of times that in my life with a young family and a wife, we didn't have insurance, and it's very stressful, um, hard on everybody. And then when something happens, you get charged and you have a huge payment. And when you don't have insurance, you tend to, like, if you get hurt or you're going to do something, you realize, or your children do something, hey, be careful. We don't have insurance. Or hey, if you break your leg, that's $3,000. You start measuring things like that in how much it's going to cost. And for myself, that's how I used to think about it. I mean, I still in a way think about that like that, is how much does things cost if you hurt yourself or you break something. And now that I'm a teacher, I've been fortunate to have insurance and good insurance. And so it's my wife and I, and we have full coverage on everything. Right now, with the illnesses that I have, I can get new prescriptions for my diabetes and my rheumatoid arthritis. And I realized I hadn't thought about that I hadn't had insurance for like a long time. And then all of a sudden, now having insurance for 10 years, it almost goes away, but not all the way, because I wonder, our jobs are precarious at best, I think, right now with everything that's going on, and it could go away again. So what can we do to where people have insurance? In January of last year, Mitch Rico had to take me to the emergency room because my sugar spiked. And when it was all said and done, they gave me 2 bags of saline in there that day, and that was not covered on my insurance, and I didn't know it. So each one of those bags of salt water cost $500 each, and the bill was total almost $1,200. And they gave me a nice payment plan where I was paying $96 a month, and I'm like, how come my insurance didn't cover that? And so I'm hoping that nothing like that happens again, and I'll be more wary. They caught me off guard with that, and next time if I have to go to the hospital, hey, if that pill or that bag of saline is going to not be on my insurance, why don't you tell me up front? How come I find out at the end that I have this deductible that I pay, and then all of a sudden I get this surprise charge? I feel like if you have to go to the hospital and you don't have insurance, it's like, can you itemize everything you're going to do so I know exactly how much it is? And maybe I'll just walk out when the bill becomes too high. If there's a way that you don't worry about going to the hospital, that everybody's treated fairly and equally, I just think that it's the best thing for our state, and I hope that it comes to fruition, and I will be a part of it if I can. Thank you.
Joseph's story. Joseph is fearful of losing his job and thus his employer-based health care. With the Health Security Plan, coverage is guaranteed, cradle to grave, regardless of employment, health status, gender, or age. Joseph has 2 chronic medical conditions, diabetes and rheumatoid arthritis. With the Health Security Plan, no one need postpone necessary care and regular checkups. Everyone will be able to afford their prescription medications, and no one will be charged copays for preventive care. Predatory pricing, billing, and collections practices by hospitals are increasing across the nation. A common predatory practice is excessive hospital charges not covered by an insurance plan. For example, Joseph's $500 bags of saline. With a health security plan, negotiation of reasonable prices for drugs, medical devices, and equipment will eliminate price gouging. Joseph's plea for upfront cost transparency is a very common consumer complaint. Patients have no knowledge of how charges are determined or what they will pay until they get a bill. The hospital and insurance company agree on a price, and the patient is required to help pay it. It's a three-party transaction in which only two of the parties know how the totals are tallied. Patients who want to know what they'll be paying, let alone shop around for the best deal, don't stand a chance. The health security plan will negotiate transparent, uniform pricing and billing across providers. The New Mexico Health Security Plan ensures comprehensive, quality healthcare coverage for New Mexicans, regardless of income, health status, or employment. Provides choice of providers and hospitals, coverage extending across state lines without network restrictions. How can you help? Become informed at newmexicohealthsecurity.org. Sign up for campaign alerts or donate to the campaign. Contact your New Mexico state representatives at nmlegis.gov. That's nmlegis.gov. Tell them to vote for the New Mexico Health Security Plan. Tell your own healthcare story at newmexicohealthstories.com. Contact us at nmhealthstories@gmail.com. Spread the word. Forward this to your New Mexico family, friends, colleagues, and neighbors. And thank you so very much.